Welcome to The Margin Line, a dental business show by Dandy. I'm Dr. Barry Bartusiak, your host. If you've ever wondered, should I do social media? Boy, are you in for a treat today. We have the queen of TikTok with us this morning, Dr. Ashley Ciapciak. Not only a dentist, not only a business owner, not only someone who has traveled across the world to do mission dentistry, but 70,000 followers on TikTok. Please welcome Dr. Ashley Ciapciak.
Thank you so much for having me.
So, such an amazing journey. Tell me where it started.
My journey in dentistry started a really long time ago, actually at the age of 13. My dad's a dentist. My grandfather was a dentist, and my dad was struggling at the time to find an assistant who would go with him to India to do a dental mission trip. So that summer, ripe age of 13, he decided I'm young but capable enough to learn how to suction and sterilize instruments and work safely in an environment that we'd be treating about 300 patients in 6 days. So that's where my journey started. I went on my first dental mission trip at 13, and we've been back to that same orphanage every year since, except for the few years during COVID. So we're going back for our next trip in January. So I started as a dental assistant, went to dental school eventually, graduated amidst the pandemic, took over his practice, started a TikTok, and have been kind of doing that stuff ever since.
So sleep is an optional item for you, I'm guessing then.
Absolutely.
So let's go. Obviously, dentistry runs in your blood. Very impressive. And we all thank you for your contribution to making the world a better place. So where'd you go to dental school?
I went to dental school at Boston University, Henry M. Goldman School of Dental Medicine, and I was a class of 2020 grad.
That had to have been beyond unbelievable with what was going on in the world at the time. How did that prepare you for the real world?
I went from taking my last board exam on the weekend before the world shut down. I had a patient in the chair, and she was a little bit concerned about this thing that she had heard about in the news. So I put a mask on over her rubber dam in order for her to go get checked by my different faculty. She came back, finished my procedure. My school shut down 2 days later. Good thing is I was already ahead of the curve, so I'd already actually finished all my requirements. So I was good to go. I jumped right into clinical practice soon after. It was a strange transition, strange time, going from normal patient care to now we're covered in gowns and masks and new masks that we'd never heard of before. So definitely a strange experience.
How did you navigate through that, the COVID pandemic, and how did dental school prepare you for some of these items?
I think that our dental school struggled in that particular realm. I think I'm blessed with the best dental team in the whole world. And I had hygienists coming up to me recommending, these different air filtration systems. I had my assistant recommending this new type of wipe. It was really collaborative. I think everyone was kind of hit blindsided. So I think sadly my school couldn't help me, but I'm sure that they're figuring it out now.
That's an incredible journey that you've had just from the get-go. You're saying that your school didn't help you much as a business person?
I think every dental school struggles to help students learn the business aspect of dentistry. They have so many requirements that we have to learn from a physical hand skills standpoint and, safety standpoint and patient care and patient management standpoint that business always comes second. I learned that stuff mostly through our office manager. I took a lot of courses online. I actually worked with a business growth team, but definitely my school dropped the ball there.
Is there a certain skill that you wish you had learned in dental school that magically you would transform every dentist, new graduate, and say, ding, this is one thing you really need to know?
Every single day in dental practice, we're going to deal with a human relations issue, meaning this assistant is arguing with this hygienist over this, instrument isn't packaged right, whatever those little things that come up. I can navigate that from a personal standpoint, but it's very different navigating it from a professional standpoint and giving guidance on how to grow that team member instead of just, scolding them or whatever. I'm not a scolder. It's never been my style. I wish that someone had kind of outlined some HR principles, with me as a leader of my team.
How do you go about your learning now?
Trial and error, like everything else, maybe. Google, that's my generation, right? No, from a business standpoint, I took a pretty hard-hitting course the past year and a half with Spear Education. I worked with Spear Practice Solutions, and basically they pull your information from your Dentrix and they throw all this information into very easy to read graphs. And I can look every single day at how much we've produced, what each hygienist is producing and what we're collecting. And which patients might be falling, through the cracks because we haven't heard from them in X amount of months. I learned a lot from their guidance.
What have you adopted in your workflow, if you will, from some of these lessons that you've learned along the way, from being a dental assistant to working with your father to sort of sitting at the kitchen table and getting a dental degree?
I think the biggest thing that I've taken away from my whole journey is patience, and that goes into every aspect of dentistry. As an assistant, I always felt pressured by dentists. I worked with a lot of different dentists, not just my dad, but I worked at 4 or 5 different practices, surgical practices, fast-paced practices. And I always felt stressed as an assistant that my dentist would start tapping their finger or tapping their foot. I couldn't mix the material fast enough. And this is before auto mixing syringes. I couldn't develop the x-rays fast enough. Yes, I trained when we didn't have digital x-rays. Anyways, so I always got stressed by that. And there's no reason for that. Your assistant can only work as fast as they can work, right? So I took that and I always use that in my brain to remember, if I'm feeling impatient, calm down, we're all human. And the same thing goes to business, mistakes in business aspect of my field. This week alone, I noticed a crown in my office was billed for porcelain fused to metal. It was actually an all ceramic crown. In my practice, there's about, I think it's a $75 difference in those fee schedule or whatever. Ceramic crowns are cheaper than porcelain fused to metal. And so that patient, I owed her $75. Whose pocket does that come out of, right? It comes out of mine, but I always have to come from a place of patience. We all make mistakes. I could have just as easily typed that code and made that error. So I always try to see everything from patience standpoint first. And then when things keep going wrong, well, then we have a conversation about it. And then, I have high expectations that you learn from your mistakes and we can move forward. So that's how we grow here.
One of the things I've always said is the best dental assistant would be an octopus, with 8 hands at the same time. Let's kind of start to take a little bit of a deeper dive here. For a dentist that's just graduating, what is the number one thing that you would tell them? Keep this in mind.
Maybe that we're all humans and that there's humans involved at every aspect of dentistry. So when your crown comes back and it doesn't fit because you're not using a digital lab like I do, you're going to have to be, patient, and there was a human involved in making that. So be kind. You're going to make mistakes and you're going to hope that your lab tech sees that margin that you didn't really clearly define, because you're a new provider, and you're going to have to hope that they can figure that out and help you out. So there's a curve, I forget the name of it in the literature, that the less you know about a subject, the more you think you know. And then the more you deep dive into that subject and into that field of dentistry, the more you realize you know nothing. And so I think as a new provider, it's always really wise to remember that you know nothing and you probably will never know everything. I mean, you can't ever know everything, but, always remind yourself, keep studying, keep learning, keep reviewing your literature. If you see something weird on an x-ray, call for help.
Having practiced for 31 years, the more I know, the less I know.
The less I know.
Let's talk about your social media experience. You have been the queen of TikTok in my viewpoint. What prompted you to start doing this?
Boredom prompted me to start making videos, to be totally frank. We were practicing at a time where we had to stagger our schedules. We felt that it was safer to wait between patient procedures to let the aerosols, settle. So there was 30-minute, 40-minute, 1-hour delays between patients. And your girl's got ADHD. I can't just be sitting around. Okay, I don't sit. I got to be doing something. And so my something became, I was watching videos on this new app. So I started by making a video talking about how, kind of common things that I explain to patients, talking about how fillings, for example, don't last forever. I have a lot of patients that think that you place a filling once and it's going to be in there for their whole life. And they're always surprised that, we've got to repave the roads sometimes. You chew at this all day long. You use your jaw joints more than any other joint in the body, and you're chewing on these fillings all the time. So people are always surprised by that. So I started by just making videos about kind of common stuff that we know, but that the normal lay person doesn't know. And I just kept making them. TikTok is such a unique social media app that consistency pays off. It's one of the very few apps that if TikTok's algorithm sees that you're posting regularly, and by regularly, back then they expected 3 times a day. You can look up statistics about that. 3 times a day is excessive amount of posting. That's annoying. Now it's 1 or 2 times every other day. That's fine. And they'll boost your content if you're posting regularly. TikTok likes that. They want to reward that behavior. So another big reason I went into it is I practice in Massachusetts. I practice outside of Boston. I practice in a pretty affluent area, but I don't always treat extremely affluent patients. I've worked in federal prisons. I've worked in county jails. I've worked in India for, an orphanage that these kids come off the street and kind of stroll into this orphanage extremely sick. So I treat patients of all walks of life, and I treat them all the exact same with respect and dignity. But there's a huge gap in healthcare and what information is available to the average patient. Not everyone can see a dentist. Most people can't afford to come to see me. So if I can put that content out online and increase the general population's dental IQ, they'll be better consumers. They'll be able to, advocate for their needs and what they'd like in their dental care. And hopefully they'll be able to find a provider that kind of matches their values. So that was another part of kind of why I continued the journey. I think a lot of dentists on TikTok should follow other dentists on TikTok because we can teach each other stuff. It's almost like a little study club. I've learned things from other individuals on TikTok that I just didn't know and I wouldn't have found elsewhere. Here's a great example. She's actually an MD, but she does temporomandibular joint dysfunction work. And she taught me one of my favorite massage release procedures that I now recommend to all my patients. I'll show you if you're interested. It's called the lateral pterygoid release. If you take your pinky and you've got someone in full bone trismus, they're in pain, take this, shove it right back behind your second molar and push in. I know where the lateral pterygoid is. I know what it does. I didn't know how to release it. She showed me that procedure, that technique, literally just pushing on that muscle and massaging it from the inside. And it has changed my life. It's changed a lot of my patients' lives. So a lot of us follow each other. A lot of us collaborate together. I do different video content with other providers. I follow oral surgeons and orthodontists and pediatric dentists. I think there's a lot of growth that just happens naturally from watching other people's content.
So in addition to relieving boredom initially, if you will, you're adding to the greater good.
Trying to.
That's awesome. Well, how has this affected your office and reputation? Speak about that, please.
So something that I didn't expect from making funny videos online about dentistry or educating on, TikTok, something I didn't expect was that people in my area would see those videos and want me as their provider. So my front office always laughs because we probably get maybe one call a week for a new patient asking to join our practice. They saw a video online. They saw me on TikTok. And my team laughs, they tease me because now I don't have as much time as I used to have during the COVID era. So at the end of the day, they'll always see me run around, I'm trying to pull one of them to make a TikTok with me or whatever it might be. And I always remind them, I'm like, that one patient though, that one patient that we just got yesterday came from this app. We're not scary to them and we might be a good match for them. So we have to remember those patients do exist. Also, my name got some recognition because if you search Dr. Ciapciak online now, a lot of my videos come up. Some podcasts that I've done like this might come up, some YouTube content. I've been asked to speak at different events and I became more accessible to the public because my name is out in the public. So that's been kind of cool.
What would you say to a doctor who is interested in doing this at this point, becoming a TikTok doctor? How much time are they investing during the week and what's it take to get started?
I think that's a great question. And my answer is probably going to disappoint you. I'd say don't do it unless you love doing it. My husband's an attorney and he started his own TikTok because he saw, what my TikTok was doing. And he didn't love making the videos. He kind of felt like a chore making the videos. And then it becomes a drag because you are posting pretty regularly. TikTok expects you to post 3, 5, 7 times a week. How many hours does that take me to do? I don't know. It might take me 45 minutes per week to whip together all those videos. Some of them are longer, some of them are shorter, whatever. But that's because I've been doing it for a while and I know what to click and what kind of sells and what, does that. I think there's much easier, much more direct ways to increase your online presence. For example, Google trigger words on your website. If you guys don't have Google trigger words on your website, you're not getting the same traction and same patient flow onto your website as, for example, our website might be getting. Instagram, don't sleep on Instagram. A lot of people find their dentist, my generation, millennials, are going to find their dentist on Instagram. I have millennial patients all the time that tell me that they found their dog, their puppy, on Instagram, right? So that's where they're looking. Gen Z might be looking on TikTok. Gen Z doesn't really need, a lot of dentistry yet. So as you kind of follow those trends, lean into different new modalities. I think older generations, still look in newspapers. They're still going to look, and ask their friends and family. They might not even Google you. I have a patient who's 104. I have no idea how she found our practice because she doesn't even have a cell phone. She's like, forget it. I'm not doing any of that stuff. Maybe she drove past. I'm not sure.
So kind of walk me through in our audience, what inspires you? What's today's video going to be about?
That's a great question. So sometimes my inspiration for videos comes from comments. Sometimes like a question in the comments or something that someone's curious about. Sometimes it'll come from conversations that I have with patients. I told you a little bit, I think I've got ADHD, so my brain's always bouncing around. Us as dentists, when we're providing care, we have the same conversation all day long with different people, right? I tell the same patients all day long, you've got erosion of your teeth. What are you drinking? Are you chugging that seltzer all day long? That's got a low pH. Oh, I didn't know that Gatorade was a pH of like 3. Well, that's acid washing your teeth. I have conversations like this all the time. So those types of conversations I try to pull into a video. And it's always surprising to see what shocks people. Recently, I made a video exactly about acid pH and sipping lemon water versus chugging it. Us dentists understand that you should chug your lemon water if you're going to drink it. Get it off the teeth as fast as possible and then rinse with normal fluoridated tap water. People don't know that. They sip their lemon water all day long. That's like sipping stomach acid, right? That's extremely erosive to the teeth, but the common person doesn't know that. So I try to pull inspiration wherever I can. Trends, I'm on TikTok looking at trends, listening to trending songs, trying to shove my niche into that trending song. So different, new stuff like that. So I'm sure I'm going to make a video later. Taylor Swift's album just came out today. I think she's got another album coming out on Sunday. I'm sure I'm going to have to make some Taylor Swift based content in the next week or two just to keep up with TikTok trends.
Again, speaking to our audience, if they wanted to get into this, you would say just kind of follow your heart then, correct?
Follow your heart. Follow what inspires you and just start making videos. Things blow up on TikTok super randomly. It could be a quick 2-second video. I had a video blow up recently because I was dancing in one of my operatories because that's how I release tension and release stress before a big case. I just did a big full mouth rehabilitation actually with Dandy for a patient of mine. And of course I'm stressed on prep day because it's going to be like 6 hours of prep and teeth. How do I deal with that? I dance it out. My team knows that I dance it out. They dance it out with me and that's fine. So I posted, I think it's like a 3-second long video. That video blew up. Why? I have no idea. I didn't teach on anything. It's random. It's like winning the lottery on TikTok. I think that they draw you as a creator by jacking up random videos and blowing those out to the public. So start making content, have fun with it. If you're not having fun with it, stop doing it, right? This should add to your experience of your dental career. It should not subtract. It should not be a chore. You've got enough chores on your plate. All of us do.
Words of wisdom for all parts of dentistry there, no doubt, Dr. Ashley. What is the best TikTok that you've ever made?
Oh, the best one or my favorite one? I'll tell you two.
That's a 2-part question, I guess.
2-part question. So I've got my favorite video I've ever made, and then I've got the video that got the most views. The video that got the most views, I actually didn't expect. It was me getting my booster vaccine for my COVID booster shot. Because I'm in healthcare, I was one of the first people to get my COVID booster. So I was talking about my symptoms, kind of tracking my symptoms every few hours after my booster shot. Worst symptom I had was a sore arm and, I kind of felt a little crummy. Talked about that in my video. I think people who are not interested in getting the COVID vaccine found that video and kind of ran with it. So that's why it got, I think, 2 or 3 million views. The wrong audience saw that video, so that was a little unique. My favorite video is an old video. I made a video to a song that says, pull me out, whatever. And I was pretending to be a tooth and I was pulling my, myself out of the screen because I was the little tooth getting pulled out. Stupid video, but that was fun.
You're very creative. That's so impressive. Let's kind of do a deep dive. You're a middle-aged practitioner. What would you say to that middle-aged practitioner with regards to maybe not only TikTok, but social media presence? Kind of give them a little bit of guidance as to, hey, try this. This works.
As a practitioner who might be Gen X, let's talk in generations, that would be probably a middle-aged practitioner. A Gen X practitioner is not going to be as confident on social media. They're not going to really understand hashtags and when to post and all those things. I think pull your youngest team member because they would have had social media as they're growing up. Pull them, have an honest discussion with them, and start talking to them as maybe becoming your social media coordinator. That said, pay them for that time. It takes a lot of time to run social media accounts. I run a bunch of different ones for different organizations. I told you I go to India every summer. I actually run the orphanages social media for them just for free. It takes hours out of their day. You should pay them for that time separate from what you're paying them to do their normal job. And always remember that everything is content. Everything is content, meaning any tooth picture. You just did replaced an old amalgam filling and now it's a composite filling and, it looks cute. Great. Snap a picture before and after. Throw that up on your Instagram. Throw that up on your website. Why not? People see that and they see, geez, they kind of know what they're doing. I'm going to go there. Post, a video of your team is having lunch together and they're just having fun. Put it in your Instagram story. People recognize those faces. They'll start seeing you guys on their feed more. And you're going to get new patients just by traction of the fact that you're posting somewhat regularly. Maybe consider getting an office phone to do something like this, just because there's a lot of storage that comes with video production too, or, photos and stuff like that. Get a nicer iPhone. That's usually enough to do it. And talk to your youngest team member, someone who might have more time. Maybe not your dental assistants, because your dental assistants have a lot on their plate. I feel like they're, the backbone of every practice. Hygiene obviously is, stuck with patients all day, but maybe a front office team member. Or consider, engaging other team people to take pictures throughout their day and just throw that up online.
The older practitioner, you would advise the same, correct?
Yeah, I think so. So I work obviously with my dad. He's 65. He's very much baby boomer generation. He does not understand any of this stuff, doesn't want to learn any of this stuff. And I'm okay with that as long as he's comfortable sometimes being in the pictures. That's our agreement and that works for him. But I think the big disconnect from his mind to my mind is how important this actually is. I think Gen X and baby boomer generation has no clue how much the millennials, Gen Z, and younger are actually spending online. They spend a ton of time online. Those younger generations are looking at your Instagrams. If you don't have a Facebook and Instagram, an up-to-date website with Google trigger words, people aren't finding your website. You need to keep that stuff up to date. You should, consider posting blogs on your website. You can hire companies to do this stuff for you too. But personalized content is what people are drawn to. That's how you get younger generations. Similarly, I've noticed a big difference in scheduling appointments throughout the different generations. So baby boomers and Gen X, they're going to call us. They're going to leave a voicemail if we don't answer. They're going to call back the next day if we didn't answer or whatever. Millennials hate picking up the phone. Don't ask someone from my generation to pick up the phone and call your office. If you only have a phone number on your website, they're not going to go to your office. They're going to look for another office that they can book that appointment online or request that appointment online. Generations younger than that, their parents are going to call them. As crazy as that is, 20-year-olds right now, their parents are calling for them because they've got anxiety for calling their dental appointments. So make it easy. Use a website like ZocDoc and have your schedule up in the computer. They can click on different options. Consider embedding these different things into your practice so that you can capture different generations in your practice.
Speaking of different generations, your dad is now your employee, if I remember correctly. So kind of walk us through some of those challenges that doctors face of, okay, dad, employee, mom, employee. How did you manage through all that?
It was an interesting transition. I think our personality types naturally kind of lended themselves towards this shift. My dad is a more passive personality type. He doesn't want to have confrontation about anything. He just really wants to do the dentistry. He never liked doing the business stuff. It was never something he wanted to do. So actually our office manager did everything, all the books, every business aspect, which is way too much to put on an office manager. That's too much. But he just didn't want to involve himself. As young as me being a kid, I'm a Capricorn if you're into that type of stuff. But I am very direct. I am very clear with, what I intend or what I mean. I have no problem in a leadership role. I've pretty much always been in a leadership role from my young days of being a competitive cheerleader to, running my German club in college. Across the board, I tend to lean into that position. So that was kind of a natural shift. I think the difficulty has come from transitioning my practice into a digital practice. So we 2 years ago went from paper charts and analog impressions to the past 2 years, everything's digital. All of our charts are digital. All of our impressions are digital. All my cases need to be submitted digitally. There's a rare case that I'll let him, and literally it's me letting him take a traditional impression. And it's when he's really stressed, really struggling, running behind. Okay, pull out your improgram. I'm okay with that. But he's taken my course where I talk about how expensive it is to use improgram for every impression. You lose money. I think I did the math. It was like $26 for that final impression. If you talk about materials, you talk about the setting time, chair time, what you're spending to do that impression versus just scanning it and sending it digitally, it's a minute and a half, right? So he's taken that class. He understands it cognitively, but there's a few times when he's just like, I just need improgum. Okay, fine. Do your improgum. We keep it in the back for him. So that's been a little bit of a tricky spot. But across the board, he's got no problem. He's ready to retire probably in the next 3 or 4 years. And he's more interested in gardening than trying to keep up with some of this stuff. So
let's go to the patient experience here for a moment. What are some things that you do on a repeatable basis that you would say to our audience, hey, Monday, do this. This has been part of my success journey.
I think something that makes our office more successful or stand out from other practices is that I try to make it clear to our patients that we care. That sounds so basic. It's not. I had a patient yesterday who I noticed she had a tongue tie. I think she was like 67, right? Told her she had a moderate tongue tie. And I started talking briefly about the connection to sleep apnea and how, maybe we should have snipped that tongue tie when you were a kid. We can snip it now if you'd like, whatever. And she's shook about the whole thing. She's like, how'd you know I have sleep apnea? I said, I didn't know that you had sleep apnea. You actually didn't note that in your medical form. You should have noted that in your medical form. I didn't know. She's like, I don't really know if I do because I just started my CPAP last week. I said, great, I'm glad you're on a CPAP. We opened up that conversation. So after that visit, sent her a follow-up email with one of my favorite books about the connection between sleep apnea and all these different things that's kind of more easy to read. Breathe by James Nestor. If y'all haven't read that book, it is outstanding. Read it. Recommend your team to read it. I made my team read it. It's outstanding. Little things like that. I sent her a quick email. Here's a quick book recommendation about the topics that we're talking about if you'd like to read it. She was blown away. She called our office later that day and was like, I'm sending my husband here. Oh my gosh, she sent me a book recommendation. It's something so small. It took me 2 seconds to send that little email, but that meant the world to her because I listened and I followed up with a little something, right? I had a patient who we ran late. We ran, I think, 20 minutes late into her appointment, which is super unlike me. I don't like running late. It's something I'm, pretty strict on with my team. Your time is valuable. Our time is valuable. Honor the patient's time is really important to me. But we did run late that day. We had an emergency. I couldn't change it. It's dentistry. So because of that 20-minute delay, we still saw the patient did her work. She was cool. I sent her a little gift card to Starbucks, $10 to Starbucks. I'm sorry we ran late. Little things like that don't cost you a lot. They grow your practice in ways that you don't expect because you've just made such a positive impact on that patient. They're going to tell everybody about you. You have no idea who they know. And I find that those little nuances, little things just go a really long way.
So to sum that up, people don't care how much you know. They only want to know how much you care. Still rings true then?
Totally true. Totally true. I mean, we go a long way to, we take pictures of stuff when I see things in their mouth. I'm very clear, I always want them to see what I see as well. But yeah, they really want to know that you care and that you care about them particularly.
Outstanding. We're going to do something 60 minutes like here, if you will. Okay. We call it rapid fire. Sort of like a this or that thing. Okay. Buckle up your helmet here. Are you ready?
Ready.
Okay. Dog or cat?
Dog.
Implant or bridge?
Oh, depends on the case. Implant? That's a hard one because I have a lot of failed implant cases, right? Bridges are so important too. Like I can't just nix the bridge, but implant, I would try it first.
Italian food or Asian food?
Oh, Chinese all the way.
Okay. Fall or summer?
Fall.
Captain America? Batman?
Batman.
Beach or mountains?
Mountains.
New York style pizza, Chicago style pizza?
New York.
Endo or extraction?
Endo. If I can, do it.
Tesla, Harley?
Tesla.
Stocks or crypto?
Stocks.
Netflix, Hulu?
Netflix. No ads.
Sunrise or sunset?
Sunrise.
Iced coffee, hot coffee?
Iced.
Dr. Ciapciak, amazing having you on. You gave us so many nuggets of wisdom. So amazing at your young age how much wisdom you have accumulated over the years and how much you have given back. Please, if you wouldn't mind sharing how our audience can go ahead and reach out to you.
Yeah, so you can find us on Facebook and TikTok and Instagram. Breedy Ciapciak Dental is what you'd search. If you want to find me on TikTok, I've also got a link tree there that you can find our website directly. My TikTok is at DRCIAPCIAK at Dr. Ciapciak. If you just write at DRC, I usually come up. So you can find me on all those platforms. Our website is office or bcdentalneedham.com. Email me office@bcdentalneedham.com.
Well, you are a superstar. Thank you all for that. And thank you for your time today. We appreciate you. Be well.
Great. Thank you.